Hi YouTubers, it's Evan X from we medical rely on the big SCR. So I'm talking right now testicular cancer. So this is cancer of the testicle. So usual disclaimers: I'm not a doctor, not giving you medical advice, nor am I a cancer patient or cancer survivor. So testicular cancer is not a super common type of cancer. Actually, it's fairly rare compared to most types of cancers. We compare it to lung, breast, prostate cancer, colorectal cancer, skin cancer. It's a fairly rare type of cancer. So this is a cancer of the testicle. Obviously, just trying to not to be too silly. Obviously it's a little bit, you get the point. So anyway, there are two types of testicular cancer in general. There's seminoma and non-seminoma. Now, non-seminoma is a misnomer because there are different types of non-seminoma, like yolk sac cancer and basically, the good news about testicular cancer is that 95% of people who are diagnosed will be cured. So regardless of when they're diagnosed, whether it's stage 1, stage 2, stage 3, or stage 4, they will be cured. That's the good news. The bad news is the treatment, even for early stage testicular cancer, is to remove one of the testicles. So they actually do remove one of the testicles because it can be unsafe to leave that testicle behind. So you will almost every person who has testicular cancer, even if it's very early stage, will lose one of their testicles. But the good news is you can still stay fertile, you can still have sex, you can still have a child even if you lose one of your testicles. So it's not the end of the world, but they will make very sure before they remove it that it is actually a malignancy. So they will make sure that there is a malignancy present, so they don't remove it accidentally. So anyway, it's definitely one of those cancers where there's not really a hard evidence, what caused it, because it's not like lung cancer where, clearly smoking is a cause, or like skin cancer where sun exposure is a cause, or colon cancer where it's diet related. It's hard to know really what caused this type of cancer. There is one type of risk factor, which is basically, I forget how it's pronounced, but it's a certain type of birth defect where when you're born, your testicles aren't hung out of your scrotum. So that's a certain type of birth defect, and that is a known risk factor for testicular cancer, is having that birth defect when you're born. Aside from that, some people have theorized that trauma to the testicles, such as horseback riding, these big-ass horses for life, could potentially, cause trauma or, discomfort, to the testicles. But aside from that, there's really no known, causes, unlike, obviously, lung cancer, smoking, colon cancer, diet, skin cancer, sun exposure. But the good news is, even if you do get testicular cancer, which is unlikely because most people will never experience it, most of it is very curable and treatable. Big ass for life. Bye.